Welcome to yet another video of Acharya Nidana Academy. In this particular video, we are going to discuss about the clinical application of arm. When I say about this particular description, so that means there may be a possibility of the undigested material that may be present in the body tissue. Either it may be in the present, maybe in the alimentary canal, or it may be in the other body tissues. Before going to this particular concept properly, so we are going to discuss about the basic concepts that we need to concretize. First, if you know about the physics, chemistry and biology and Ayurveda fundamentals, then any of the information mentioned in Ayurveda can be learned with deepest understanding. Second, when you want to know about the each and every concept with deep dive understanding, we need to practice the concept of minimalism. The term minimalism refers to we have to take one small topic and from multiple angles we have to learn this particular small topic. For example, the concept of dosha from the point of Rachana Sharira, from the point of Kriya Sharira, from the point of Roga Nidana, from the point of Shastra Vaishya Kalpana, from the point of the Dravya Guna, from the point of Kaya Chikitsa, from the point of Agata Tantra, Shalya, Shalakya Tantra. So like that, one particular concept from multiple angles, we can have a deep dive understanding. Third, if you want to know about the each and every concepts of Roga Nidana, then first of all we need to know about the Kriya Sharira well. Because extended Kriya Sharira is nothing but Roga Nidana only. And what is the benefit of learning Roga Nidana? So that means extended learning of Roga Nidana is nothing but Kaya Chikitsa. And wherein Kaya Chikitsa is having multiple subjects, that is the learning of the subjects, that is Roga Nidana, RS Shastra Vaishya Kalpana, then Dravya Guna, Agata Tantra, Swastha Vrita, etc. That is all categorized under one particular small heading, that is Kaya Chikitsa. And fourth major concept, whenever if you want to have the great learning, try to identify the patterns. So the pattern identification necessary for the pattern modification, and then which may be helpful in creating a new pattern, that is pattern creation. For example, when a person is consuming the sour curds, 300 ml of sour curds mixed with salt at 10 p.m. consecutively for a period of 10 to 15 days at night time, so that means he is following a particular pattern in terms of quantity, in terms of that is the timing, in terms of the amount, in terms of the nature of food. When you look into that, he is continuously following one particular pattern specifically at night time, which in turn results in the increase of pitta dosha in the body. When there is increase of pitta dosha happening inside the body, naturally we can able to say if a person is started consuming, adding the pepper, adding the green chili, there may be a possibility of still much more increase of pitta in the body, we can able to predict. So that means pattern modification necessary. Why pattern modification? To subside this particular increase in pitta dosha in the body. And afterwards pattern creation. Pattern creation should be the motto of, so that is the main aim whenever if you want to restore the person's health. No compromise will be done while learning about the Ayurveda fundamentals. And you have to follow one particular mentor. Why one particular mentor? Because nowadays when you look into the present day information overload, multiple informations are available, millions of informations are available from the multiple angles. So that means they are forcing you to look their point of view, you look their point of view, their thought processes from their angles. So if you are doing that particular, if you are following multiple lists, multiple author, multiple mentors, so that means you are not in a position to come to your what actually you can do, what actually you have to do, you cannot do that. So that's why whenever if you want to follow, look into the patterns so that you can able to identify his past thought processes, present thought processes, and he can predict what might be the future thought processes. And whenever if you look into the information gathering, that is collecting the information. Ayurveda information has to be learned through the Ayurveda itself, and Western information has to be learned from the Western point of view, and try to mix these information at different time intervals, at different levels, and if it is possible for you to the match these information, then that may indicate we are moving in the right direction. And last point, as far as concept understanding is concerned, you have to learn Ayurveda like learning a new language. New language, the more frequently used words has to be learned first in terms of meaning, etc. And then less frequent words, then less frequently used words. In that way, you have to follow. This is how we can learn the Ayurveda better. Before going to the concept of Ama proper, we need to know about some of the basic informations in terms of whole concept of digestion and assimilation. In the extreme left side, so that is an alimentary canal which is having 5 major organs. Then right to that is intravascular compartment, and right to that interstitial compartment, right to that intracellular compartment will be present. When you look into why this is only 5 organs in terms of alimentary canal, so that is being specified based upon the duration of stasis of food on these organs. So for example, in the mouth, that food may remain for a period of 2 or 3 minutes, whereas in the esophagus the food may not remain that much time period. That will be moving from the mouth to from the pharynx to the stomach within seconds, and in the stomach the food may remain for a period of 2 hours, whereas in the small intestine that may remain for a period of 6 hours, and in the large intestine for 24 to 48 hours. And these are actually necessary, that means this amount of the time period that may be necessary for the conversion of macromolecules into the micromolecules. When they are converted into micromolecules, either that may be present in the stomach or that may be present in the small or large intestine, that will be entering into intravascular compartment. From there it will be, as they are micromolecules, that will be entering via portal circulation into the liver. From there it will be entering into hepatic vein, from there into inferior vena cava, and then heart, and then into general circulation. This is how this movement of the that is that alimentary canal, from there it will be entering into intravascular compartment. And when that particular food that is entering from the blood vessels, from the arteries, it will be entering into the capillaries. From there it will be entering into the interstitial space, and from the interstitial space these nutrients etc. that will be moving into the cells. That is what is considered to be intracellular compartment. This is what is considered to be movement of the food substances that is going to take place from gastrointestinal tract to intracellular compartment. And when you think about the pathogens, so the pathogens that will be moving from mouth into the stomach in a similar manner only, that will be entering into the stomach, so that will be moving, and that is responsible for the inflammation. From there they are responsible for the production of the proteins. These inflammatory markers, they are going to get entering into the intravascular compartment, and as they are macromolecules, they are bypassing portal circulation, they enter via lymphatic circulation into the heart. And when you think about the abnormal diet patterns, wherein the source of the entry will be mouth, that will be adhyashana, vishamashana, samashana, viruddhashana, and one more, that is atyashana. So when you think about these aspects, abnormal diet patterns, adhyashana, let us look into the adhyashana only. When you think about adhyashana, the person will be consuming the food before the digestion of the previously ingested meal. So that means in that particular situation, the amount of the food that will be present in the lower end of the stomach. And when a person is doing the adhyashana, so that actually they are considered macromolecules. So they come and occupy the lower end of the, what do you say, that the stomach. And what actually happens to the earlier ingested meal? They are usually either macromolecules or intermediate molecules. They enter into the periphery. So these are earlier ingested meals. They may be having the lesser molecular weight. Hence, the heavier molecular weight, they occupy the lower end of the stomach, and already ingested meal, they occupy the upper end. Hence, when the pyloric antrum that is going to get opened, so these molecules, they are present at the lower end of the stomach, they move further. And already present these molecules at the upper end, they are not in a position to move before these substances. And why they are remaining macromolecules or intermediate molecules is because of Agni-mandya. Why Agni-mandya occurs? When a person is consuming the food, doing adhyasana, so that is actually responsible for the dilution of hydrochloric acid. When there is a dilution of hydrochloric acid happens, the next phase will be inactivation of pepsinogen into pepsin. When this is happening, the macromolecules, they are not in a position to be converted into intermediate molecules or macromolecules. Hence, they are sticking to the walls of the either greater curvature or lesser curvature. This is how they are actually, they may remain in this particular stomach wall for longer amount of time. And most of us are having the consumption of carbohydrate rich diet, be rice, or maybe because of, what you say, that the wheat, etc. Most of us are consuming carbohydrate rich diet, and sometimes even the sweets, etc., milk products, and the some of the substance prepared out of the sweets or lassi, etc., they are containing carbohydrate rich diet. And because of the carbohydrate richness in their diet, so these pathogens, they are considered to be entering via mouth. They are responsible for the proliferation of infection to happen. And when there is proliferation of infectious organisms, they happen, they are usually responsible for the inflammation to occur in the stomach. When there is inflammation happening in the stomach, they are responsible for the inflammatory markers production, which are nothing but proteins. And when there is proteins are being present, they are actually responsible for the damage to the gastric mucosa. And when there is damage to the gastric mucosa, so these macromolecules, they are present in the stomach, they may get lodged in these damaged gastric mucosa for even longer time, which in turn leads to the movement of the macromolecules to enter into the interstitial compartment of the stomach. And when there is the movement is happening, as they are macromolecules, they enter into the lymphatics. From there it will be entering into the thoracic duct. From there it will be entering into the superior vena cava at the junction between the left internal jugular vein and left subclavian vein. From there it will be entering into the heart and then into the general circulation. This is how the movement of these particular macromolecules or intermediate molecules that can happen from the stomach to the heart level. From there these may enter into the interstitial compartment as these macromolecules enter the capillaries. From the interstitial compartment, if these macromolecules enter into the interstitial compartment, from there it will be entering into the cells from the interstitial compartment. This is what actually is happening in terms of, what do you say, that the mechanism. When you think about the presence of the macromolecules or intermediate molecules in the stomach, small intestine, large intestine, we can say it could be a Koshtagata ama. Whereas the macromolecules present in the intravascular compartment or interstitial compartment or intracellular compartment, we can say it could be Dhatugata ama. This is what we have discussed earlier. These macromolecules, they are going to enter into the, from the GIT, from there it will be entering into the intravascular compartment, from there it will be entering into the intracellular compartment. So now when you think about the improper digestion is happening in the stomach, that means the macromolecules are present in the stomach. Because of the poor hydrochloric acid, these macromolecules are unable to convert it into intermediate molecules. There are two possibilities. Either the person may have vomiting because of the closure of pyloric antrum for even much longer time, or otherwise there may be a possibility of entry of these macromolecules into the small intestine. And when they are entering into the small intestine, they are usually moving from the wall of the small intestinal wall, just like the small stomach itself. So that means they are, as they are macromolecules, they are moving very slower. So that means they are going to have the similar mechanism as that's happening in the stomach, which may be responsible for the inflammation to happen in the small intestine. In turn, so that will be responsible for the, what do you say, that these macromolecules to enter into the interstitial compartment of the small intestine. From there it will be entering into the lymphatics. From there it will be entering into the superior vena cava, then into heart, then into general circulation. Similarly, because of the poor digestion is happening in the small intestine, these macromolecules, they enter as they are into the large intestine also. And when that is happening, and these, as we have discussed earlier, they are nothing but carbohydrate diet, which is entering into the small intestine, the same may enter into large intestine, thereby that may be responsible for the inflammation to happen in the large intestine too. And when this inflammation is happening in the large intestine, again that is considered to be macromolecules are present in the large intestine. Large intestine mucosal damage. Large mucosal damage, macromolecules enter from the large intestine into the interstitial compartment of the large intestine. From there it will be entering into the lymphatics. From there it will be entering into the thoracic duct. From there it will be entering into superior vena cava, then into the general circulation. In other words, if the macromolecules are being present in the stomach, which may produce the symptoms related to sama kapha, and the macromolecules, if they are present in the small intestine, that may lead to the manifestation of sama pitta lakshana. And the macromolecules, presence of macromolecules in the large intestine, that may produce the lakshanas in relation to sama vata lakshana. So now regarding some of the facts that we need to remember before going to the further concept. So that is regarding the capillaries. It is being said in the guidance physiology, nearly around 10 billions of capillaries are being present in the human body. And it is also being mentioned in the same textbook, that is, heart will be pumping the blood nearly 60 to 100 beats per minute. But the capillaries will not be having that much amount of the movement of the blood, all the capillaries. So they will be having once or twice per minute only, depending upon the nutrient requirement, depending upon the that is what is ischemia, etc., etc. Once or twice there will be the movement, and movement of the blood is happening in the capillaries. It's nearly around 0.3 millimeter per second, and diameter of the capillary, that is considered to be 4 to 9 micrometers, and thickness of the capillary wall, that will be around 0.5 micrometer. Now regarding the movement of the nutrients or pathogens, that will be happening in the different parts of the body. Why that pathogen that will be moving in that particular direction only? Answer is this one. Suppose if this is a human body, if this is considered to be the abhyantara roga marga, and this is considered to be intravascular compartment, and the greener one, that is interstitial compartment, and the orange colored one, that is intracellular compartment. So that means every part of the body, upper limb, lower limb, trunk or head, that will be having these intravascular compartment, interstitial compartment and intracellular compartment. When a person is doing more amount of writing, or when a person is doing more amount of vegetable cutting in cases of the cooks, and if the person is doing more amount of the exercises with hand, so that will be responsible for the increase or movement of the pathogens to happen from the stomach to intravascular compartment of the upper limb. From there it will be entering into the interstitial compartment of the upper limb. From there it will be entering into intracellular compartment of the upper limb. Suppose if the person is doing walking, running, jumping, etc., etc., so wherein the skeletal muscles of the lower limb that will be in more action. So that means whatever the pathogens they are being present in either small intestine or the stomach, small intestine or large intestine, so that will be entering from there into the intravascular compartment of the lower limb. From there it will be into interstitial compartment. From there it will be moving into the intracellular compartment of the lower limb. If the person is doing any of the activities in relation to the abdomen or the yoga exercise related to abdomen, the more amount of the nutrients or pathogens that may move from stomach to the intravascular compartment supplying the trunk region. From there it will be moving into the interstitial compartment of the trunk region. From there it will be moving into intracellular compartment of the trunk region. And if the person is doing more amount of the thinking activity or playing chess, etc., etc., wherein the pathogens or nutrients, more amount of that will be entering into the intravascular compartment of the head. From there it will be moving into interstitial compartment of the head. Then that will be moving into the intracellular compartment of the head. If the person is doing two such kind of the activities, for example vegetable cutting and walking and running, etc., the more amount of blood supply will be observed, or the new pathogens that may enter from the stomach to upper limb and lower limb. So in this way the channelization of the nutrients and pathogens that will be happening. So hence when a person is doing more amount of the activities in relation to the joints as such, the pathogens entry that will be observed in the joints where the more amount of the activities they are going to take place. Hence in the person who is suffering from Amavata or Vata Shonita, more amount of the blood supply will be observed in the joint region or in the region where the pathogenesis is happening, right? So the take home messages from today's session that will be: the source of entry in case of ama formation that is going to take place from the GIT through the oral cavity. So that means the ama formation is happening in the GIT, that is in case of Koshtagatama, that is ama will be present in the alimentary canal, wherein the Shakagata ama, wherein the pathogen or the ama that can be observed or macromolecules that can be observed in the intravascular compartment or interstitial compartment or intracellular compartment. And 5 types of abnormal diet patterns that can be usually responsible for the ama formation in the alimentary canal. They are Adhyashana, Vishamashana, Samashana, Viruddhashana and Adhyashana. By applying the principles of physics, chemistry and biology, we can have a deep dive knowledge of ama. And any concept can be learned with deep dive method by this application, that is physics, chemistry and biology application. That's all for today. And if you are liking this particular video, then like this particular video, and what are the major key takeaways mentioned below. If you want to have a new information to learn, what is that particular information, one information you would like to learn, mention below. And if you are truly liking this particular video, then spread this particular video to maximum the true Ayurveda learners, so that we can make a huge movement from this small message. Thank you.